Hello, Dr. Hill, back again. Another video coming your way. You guys know that I love when you guys send in questions, comments. I get a lot of memes, obviously, because that's a big thing that we do here. But I love when you guys do that, so please keep doing that. So today's video, we're actually going to answer one of the questions that we got on one of the past videos. Jana Flint, thank you for the question. Always good to see. But her question is, or questions are, can you do a video on wisdom teeth FAQs, frequently asked questions? Like, why do we have them? What are they? Does everyone have them? Are wisdom teeth really wise? Nice one. I like that. I feel like I need to know these things. Fantastic question. I do appreciate you writing that in. And we can do a full video on wisdom teeth and we'll make it fun. Why do we have them? To cause frustration for the patients, the dentist, and to keep my oral surgeon buddies in, obviously, working. But I'm just kidding. That's not true. But my friends will kill me for saying that, my oral surgeon friends. So why do we have them? Well, obviously, let's backtrack. I will tell you, not everybody has them. We'll answer one of the other questions. Not every patient has wisdom teeth. Some people, which is a common answer on wisdom teeth, is most people have 4 when you're thinking about it. Most people, not all people. Some people have none. Some people have 1. Some people have 2. Some people have 10. It's all over the place. It's all about when the teeth are formed, when the body's formed, the tooth buds, which is basically how teeth grow inside you and become what they are. There's different ways and there's a different amount. So every single patient has their unique own wisdom teeth set. Are they really wise? Yes, absolutely. They're wisdom teeth. They got their name for that. So of course they're really wise, which is also true. Now, what are they? Basically, wisdom teeth are the teeth that are all the way in the back, on the top and on the bottom. Now we're going to just basically say that a patient has 4. So I'm going to say that I have 4 wisdom teeth, which I did. I had 2 on the top, all the way in the back, and I had 2 on the bottom, all the way in the back. Majority of patients do not know they are there. They are kind of hidden up and back in the bone structure, okay? Very rarely or sometimes will they come out, they'll start making their way out. A lot of the times, these wisdom teeth can cause patients issues. Pain, sensitivity, headaches, jaw issues, things of that nature. That's the first sign that it's time for those bad boys to come out, okay? On the majority of patients, they serve no purpose whatsoever. Now, that's the majority of patients. There's always the little asterisk when you do things like this, but that's the majority of patients. They're back there. They do nothing for us. Very rarely do they ever come out or anything like that. They just become an issue for most patients as we age. When do wisdom teeth come in? Again, generally speaking, every single patient is different. I have seen patients where I have pulled a wisdom tooth on a man that was, I think he was 65 plus years old. Never even knew he had a wisdom tooth. Majority, and what you'll end up having is patients that are, I would say, anywhere between the ages of 16 to 25 is pretty a safe range for patients to really start having that conversation about wisdom teeth. Where are they? How many do I have? Do they need to come out? Am I going to start having issues, problems, pain, things like that? Dentists and dental offices have certain types of x-rays that we can take that allows us to see where those wisdom teeth are located and if they potentially could cause you issues. The reason that I explain it to my patients as to why we get them out when we're a little bit younger is because not only are you going to heal faster, but it's actually easier when the tooth is still forming for us to kind of literally pop out those wisdom teeth. Another question that I get a lot of the times is actually, number one, is it going to hurt? Am I going to have pain? Is it going to be hard? All that kind of stuff. Those are great questions to ask your dentist and their team that's around them. I will tell you, when done properly, the majority of the removal of wisdom teeth are not going to have any issues. Obviously, there's always going to be those problems where things don't go right. The wisdom tooth is just causing issues for the dentist. Patients kind of tough to work on. There's a million reasons why things couldn't go right. The majority of the time they will. We'll get in there. You're not going to feel anything. You're going to be numb. The majority of patients are actually put to sleep by a general dentist like myself and or our oral surgeon friends that do almost all wisdom teeth all the time. Okay, they're trained in them. They do them all the time. It's easy for them to do them. That's why a lot of patients get referred to oral surgeons to take care of that. Do I need to get them taken out? Me, as a dentist myself, if they are going to cause issues, or if I think or believe they're going to cause issues, they're going to cause problems with teeth that are in there. They're going to cause shifting of teeth. They're going to cause you jaw pain, potential infections, things of that nature, gum loss, bone health, all that kind of stuff, all plays into it. I am of the belief that when you are younger, to have them removed. I know some dentists are much more conservative on that, where they will kind of see what happens, let things happen, go as they will. To me, I don't believe in that. I think we get your wisdom teeth out when you, well, I guess not you, when the dentist feels or sees fit, because as we're younger, we heal quicker. It's not going to be as painful, obviously, as we're younger. And then as we age, you become a lot more prone to bigger issues. Medical health, all that kind of stuff plays a part, okay? Are my wisdom teeth impacted? Okay. First of all, let's go with what the term is in that context. Impacted in the mind of a patient or someone out there like that is the fact that they are kind of in a weird position, a weird location, a tough position, a tough location, or they're underneath the bone. They're going to have to remove bone. All that kind of stuff is what I believe that patients are asking as, are they impacted? Impacted wisdom teeth are a little bit more difficult to remove. There's a higher possibility of having issues or post-op sensitivity, things of that nature with impacted wisdom teeth. Now, I will tell you, when done right, when properly anesthetized, when given the proper medications and the proper either bone grafting or a membrane or something like that to help heal and suture those back up, patients still should not have more issues or anything of that nature with that. Okay? Heal faster when you're younger. Always remember that. Personal experience with my wisdom teeth. I'll just tell a quick little story and then I will get out of this video. But my wisdom teeth story. Great guy, awesome oral surgeon, did my wisdom teeth when I was younger. I think I was 17 years old. I was a senior in high school. Had time to get them out. They needed to come out. Go get my wisdom teeth taken out. Everything goes well. I never had any issues with them. Fantastic. Went really well. But went back home. All I ever wanted, I was put to sleep. All I wanted was a chocolate milkshake from McDonald's. That was it. I kept telling my mom, I want a chocolate milkshake. I want a chocolate milkshake. And now everybody's seen those videos of patients after getting wisdom teeth taken out, which I think we're going to potentially do one. Now, when I went back, I want the chocolate milkshake. Came back, put the chocolate milkshake down, drank the whole thing. I was starving. So I kept complaining. My mom walks in. I'm like, hey, we need to get some more food. I'm starving, all this kind of stuff. Well, push come to shove, I didn't drink any of the chocolate milkshake. I wore the chocolate milkshake. My couch wore the chocolate milkshake, and my mom was pissed about, I think, ruining her couch. But needless to say, that's a little side story of that. But we didn't have cell phones back then when I did that, so nobody could video me doing that, which is a blessing in disguise. But great question. I love these questions. Please keep them coming. They're awesome. Get your wisdom teeth evaluated if you need to. If not, like, subscribe, comment, send me some stuff. Let's keep doing some more videos. Appreciate you.